My name is Beth Kaplanek. I am author of Pilates for Hip and Knee Syndromes and Arthoplasties, and I'm very happy to be here with all of you today in order to share a little bit about myself and how the book got started. This is a two-part video clip. The first part is introducing myself and a little bit about the book. The second part, we're going to be getting into the details of the book and how to use the book more efficiently. But let's get started on exactly how the book got started. One day, I walked up a mountain when I was on a fitness trail with my husband, and I came down with pain. And that was about 14 years ago. And it persisted and did not go away. So I sought the help of a local orthopedic surgeon. He took an x-ray of my right hip. He came in and he said, "Beth, you're going to need a hip replacement." Well, I must say that was one of the most shocking moments of my life. And I'm thinking, are you kidding? How could that be? I'm a very active nurse. I teach fitness for a living. I love to teach aerobics. I love to dance. I'm an equestrian rider and jumper. I'm a personal trainer. I didn't want to lose a part of myself. And I certainly didn't want to lose what Beth enjoys doing. I thought that was the end to that. But that's almost another story, and I'll come back to that on a different video clip one time soon. I realized that I did have a condition. After the shock, I started to get reality. I have a condition called slipped capital femoral epiphysis, which means that the growth plate on top of the ball that fits in the socket had a slight slippage on both the right and the left side, can be caused congenitally or an accident that could have happened before a certain age, which I did have a water skiing accident, and that could have caused my problem. But we're not clear. Nevertheless, it was time for me to start looking for a surgeon. So I found Dr. William Jaffe. He is a renowned surgeon at NYU in the Hospital for Joint Disease. He's a clinical professor, a researcher, and very well known in the field, and an entrepreneur. He replaced my hip in August of 2001. By June of 2002, I was well on my way to teaching Pilates, the mat work. We had a long discussion one day when I went to see him, and he wanted to know what I had been doing because my right hip looked great, but he really liked the condition of my left hip that had not looked like it really had deteriorated any further, and maybe even looked a little bit better. So that was very promising to him, and it was very promising to him that he felt it really should be showcased. So he started learning a little more about Pilates. I started helping him, and he assigned me to work with a gentleman called Dr. Brett Levine. He asked us to start a manuscript article showcasing Pilates as an incredibly important form of fitness post-operatively for clients with hip replacements. And that's how we got started. I had started writing the book at this point, and very soon after that, Dr. Jaffe and Dr. Brett Levine are both now co-authors of the book that was published in June of 2011, 10 years later after my hip replacement, come to think of it. Well, we had several goals in mind for this book. We needed to showcase Pilates as being a very valuable form of fitness for the community of people with hip and knee syndromes and arthroplasties. It's a very well and good form of low-impact fitness. B, it helps strengthen the joint and increase the integrity of the pelvis. It helps with setting up the alignment in an appropriate way. It's very core strengthening. It increases balance and flexibility and range of motion. And those are just a few of the many benefits of Pilates. And we wanted that showcased to other orthopedics so they understood the values so they could refer their clients. In addition, I wanted to help instructors to feel more comfortable to work with this population, to have modifications and something in front of them that would just make it so much more efficient and easier to move forward with that type of client and be comfortable with that. I want clients to seek out Pilates and see it for its value and its benefits. All of those goals in mind were a part of the making of Pilates for hip and knee syndromes and arthroplasties. Okay, the book was published in June of 2011. It's been 11 years since my hip replacement, and I've been able to keep the space and integrity and work without pain. And that's very encouraging for me. It also should be encouraging for all others out there that are facing potential joint replacement. Everything starts with a syndrome. In some cases, you might even be able to push off or prevent a joint replacement. I want you all to know that I think Pilates has been a wonder for me, and I want you all to seek it for yourselves. If you are an instructor, help other clients know about Pilates. Okay, if you're a client, look for an instructor to help you with the movements. I want to thank you all for being here today to listen to me. If you'd like to reach me, contact me at beth@bethkaplanek.com. Take care and have a wonderful day. Bye now.